You think about it. Maybe when you were a little kid, you had a similar experience that I did in a small town. You knew who your neighbors were. You hung out with your neighbors, talked to your neighbors. Raise your hand right now in your car, in the Ryan or the Kennedy or the Stevenson or the Eisenhower, and tell me if you know your neighbors' names.
Or a side street.
Mm-hmm.
I know my neighbors.
Look around, see if people in other cars are raising their hands.
Yeah.
Well, but see, this is interesting because you are a good example of how to live in a neighborhood because you and Kurt, your husband, you moved to this new neighborhood. You went around and met everybody, and you're very social. People aren't so much anymore.
Right.
So anyway,
Keep it private.
we bring in Kim Serrano here to help us fix us, director of the Center for Inclusion and Belonging. Does medicine recognize loneliness seriously, or is this one of those walk it off kind of things that they treat?
Hi, Steve. We're seeing medicine is certainly taking loneliness seriously.
Good.
In fact, the Surgeon General recently issued an advisory about loneliness and has called some of the trends that we're seeing in research a loneliness epidemic, which is something that Surgeon Generals in the past have done for other really concerning public health trends, things like smoking and the spread of HIV and AIDS, and as well as gun violence. So definitely loneliness is something that is being taken seriously. Now,
this is something that we would attribute in the past to old folks. A husband or a wife dies and it's old folks and the kids don't visit them enough, and it's all that. This is all ages, right, Kim?
Absolutely. And in fact, that's something that I think was really surprising in some of the recent data that we've seen is these trends are actually increasingly pronounced among young people. So we've been seeing that loneliness among young adults has been increasing every year between 1976 and 2019, so for about 30 years. And young adults are actually almost twice as likely to report feeling lonely than those over the age of 65. So definitely something we're seeing across age groups and certainly concerning some of the trends among young people in particular.
And Kim, I think it's interesting we talk about the mental health tsunami that followed the pandemic, and we're certainly still dealing with that now. This new epidemic, which would be loneliness, is something that we should be talking about more. Probably started before pandemic. It got a little bit more bigger because of the pandemic, but you can still feel lonely even if you're around a lot of people. Explain how that is something.
Absolutely, and you're absolutely right. These trends around loneliness is something that we've been seeing for quite some time, and awareness of it as a result of the pandemic and during the time of the pandemic certainly has increased. But part of what we're learning is the experience of loneliness really is often about different challenges with social connection. So that doesn't necessarily mean that one doesn't have a lot of relationships, but it may mean that the quality of those relationships isn't meeting someone's need, or that the structure of those relationships, the kind of format that those relationships take, isn't of the right blend to be making a person sort of feel fully seen and like their full self.
Online during COVID, just common sense-wise, I would think, well, made it worse because we were all insulated, we were home, but it also is a way we all connected in different ways. Did things get worse or better during COVID?
We're still trying to understand some of the data from the pandemic period, but one thing that we have learned a little bit about since the pandemic is a little bit more about belonging, which is this other trend, in addition to loneliness, that we're looking at and trying to understand a little bit better. And one of the things that our team did in 2021 is try to understand, what's the state of belonging in America. And we actually ran a large national survey to kind of take the pulse on the state of belonging, and found that about 2/3 of Americans were actually experiencing a lack of belonging. So also kind of a troubling trend from the kind of coming out of the pandemic period.
Yeah, I was just going to say, I would argue, too, that this work from home thing doesn't help because you don't have the interconnectivity that you would have when people get together in the office.
Definitely we're trying to understand the workplace impacts, certainly, of, being in a work from home situation, remote working, hybrid working. And one of the things that we saw was actually about 64% of Americans, those kind of white and blue collar workers, folks working in offices and folks working remotely, were reporting that sense of a lack of belonging. It's certainly, being in remote work and working from home creates a different kind of a opportunity for employers to figure out, how do you meet the needs of your team and help your staff and your employees really feel like they're part of the workplace and that they belong.
So belonging is this term now that we're starting to hear more and more of, thanks to you. And you've got the belonging barometer, and we can talk about that. I'm curious, though, I would imagine social media and technology might hurt your belonging, your feeling of belonging. And it's better to, say, join a community group or go to the park or the library. What can we do to sort of enhance this word belonging and make it part of like the national, concept here?
Yeah, one of the things that we're seeing about belonging is, it feels a little bit amorphous sometimes. It's sort of like, what does that mean? And what is that? And part of our research was trying to wrap our arms around that, figure out, look at the best science and bring together what we know about what belonging is, and then try to figure out how do we measure it. And so a couple of the things we learned, about what it is, it really has three prongs. So one of those is social connection, which is deeply tied to loneliness, which we've been talking a little bit about. Another one of those prongs is psychological safety, and that's this idea that one can feel like their authentic self without fear of judgment. And then the third prong is actually co-creation and agency. So this feeling of being able to contribute and have power and be listened to and heard. And so when we think about social media and technology and things like that in the relationship to belonging, I think it's really helpful to think about each of those prongs and the ways that, sometimes technology could support building belonging, but sometimes certainly it could get in the way. It could give us the feeling that we're being socially connected or the feeling that we have agency, but we may not be actually experiencing relationship with other people in the ways that our brains and our bodies need.
I'll leave you with this, too. If you come across somebody in the workplace or in general, or maybe it's a family member that's socially awkward, that seems standoffish, that you go, well, they're just a little different, reach out to them. It could just be that they don't know how to connect in ways that you do. Maybe you're a little more natural at it. And if you want to do one good deed today, find somebody in your life that doesn't seem to have a lot of connections and connect with them. Doesn't mean you have to buy them dinner. Doesn't mean you have to hang out with them. Just check in with them. Yeah, that's all. It's a start.
A quick call.
Absolutely. And, and being able to, some of what we're learning from getting this pulse on belonging in America is that actually a lot of us feel this way. We're seeing 64% of Americans in the workplace, 68% in the country, and 74% in local community feel a lack of belonging. So the odds are, if someone who's feeling like they don't belong, and if it's something that you're feeling, the truth is you're actually not alone. And so you are absolutely right, Steve, that being able to take that step of being intentional and reaching out is a great first step to building belonging.
Well, Kim, if you feel sad or lonely, call us. We're here.
Appreciate that. You guys are a great group to spend the morning with.
That's right. And we'll be here till 9.
Thank you, Kim.
Thank you, Kim.